just wanted to use this opportunity to share that what we have gone through today um, is a really amazing set of responses from large scale public sector initiatives on social protection and gender equality, which really cut across education, health and nutrition, stunting, um, social protection, income stabilization that we heard from Dr. Sania Nishtar. And it has been just very exciting to hear each one speak to different aspects, which make us think that today we are talking about gender equality in a highly liberated manner and powerful manner, where the Sustainable Development Goals 2030, if they had to be achieved, they would only be achieved if we did come through when it came to issues of gender equality. And if gender equality was achievable today, and that's what we need to be working towards more and more, that's the only way we will begin to see uh, the fruits of our labor leading to our victories when it comes to the Sustainable Development Goals targets. But nothing can happen unless and until we are inclusive. And we forget that almost 15.5% of our children, even 5 to 15, 16, suffer from some kind of disability or the other, but there's a culture of silence about it. That's what organizations like Sightsavers and leaders like Munazza Gilani, with the government, with the parliamentarians, with decision makers, are trying to change. Let's try and see if we can hear Munazza Gilani's message.
Domestic violence during an emergency context, such as COVID-19. And the economic impact of the pandemic can create additional barriers to leave a violent domestic situation and create higher risks of sexual exploitation and consequential economic deprivation. The list of challenges is, however, not limited to violence only. Women and girls with disabilities confront many other challenges, including inaccessible communication by the service providers during and before the pandemic regarding the benefits available for them, the mobility challenges for women with disabilities, that how they can get out of their homes and get access to any benefit or service available by any state actor or non-state actor during the emergency time. And in addition, there is very limited data available on the impact of COVID-19 on women with disabilities. So let me share some key statistics around the intersectionality of gender and disability. The World Report on Disability tells us that the prevalence of disability for men is 12%, while for women it is more than 19%. The global literacy rate for persons with disabilities is as low as 3%, but for women with disabilities it is around 1%. In the same way, women with disabilities are less likely to get any livelihood or economic participation activities. This further increases their marginalization and vulnerability during any emergency or disaster situation. The women with disabilities, they experience higher rates of gender-based violence, sexual abuse, neglect, maltreatment and exploitation in comparison to men with disabilities or in comparison to women without disabilities. They are also 3 times more likely to experience gender-based violence compared to non-disabled women. As far as the impact of COVID-19 is concerned, some of the examples of factors that can contribute to the existing gender gap in disability, as I mentioned earlier, includes like double discrimination faced by women and girls with disabilities, which is often compounded by other factors such as being minorities, indigenous people, a person living with HIV and AIDS, and also older people. Furthermore, lack of empowerment and capacity development of women and girls with disabilities, especially including them in the leadership processes and their participation in the decision making in political, economic, and social spheres is also very limited, because most of the time they are either invisible or they are not counted for such processes. Moreover, the strategies focusing on the disabilities don't necessarily result in the enhanced gender equality among people with disabilities, such as including implementation and monitoring of the different conventions that we have signed and ratified for Pakistan. Evidence also indicates that the greater gender equality in education and employment can make a significant contribution to development and economic growth. And as stressed in the Incheon strategy to make the right real for persons with disability in Asia, particularly in South Asia and the Pacific, promotion of gender equality and empowerment of women with disabilities is very important for the achievement of the disability inclusive development. Moreover, to advocate for the rights of women with disabilities in society and in development processes, it is essential that their perspectives be included in all aspects of the work for women's empowerment, and that all work on disability incorporate a gender perspective, a gender lens. I'm quite certain that without the meaningful participation of women with disabilities in the disability dialogue, the goal of nothing about us without us cannot be achieved. So as development actors, we need to make our thinking and planning more inclusive for all, particularly for persons with disabilities, especially women with disabilities. And we need to collect adequate and relevant sex disaggregated baseline information for any program, be it a disability focused program or be it a mainstream development program. We should use gender responsive indicators and monitoring processes as a minimum standard for our plannings and activity designing and its monitoring on regular basis. So I'm hopeful that I was able to highlight some of the key challenges faced by this community, and please do not hesitate to share with us your ideas in this context, that how we as a civil society can get together and share our efforts with each other without any duplication of efforts and resources, and can improve the lives of persons with disabilities, especially women with disabilities in these difficult times, especially during this pandemic. So I look forward to your suggestions and wish you all good luck for all your endeavors in this difficult time.
Well, I just wanted to thank Dr. Munazza Gilani, because one of the big areas of our work which still gets undervalued is the whole area of inclusion. And as she mentioned that, where is the voice? Where is the choice for when it comes to women with disabilities who are triply discriminated against? These are very big issues. And I remember just now on the 8th of March, when we were part of the Aurat March, all of us from all our offices, all districts, wherever we were working, this has been one of the big issues that we are talking today about, an equality which is there without discrimination, and ensuring full inclusion of girls and women in every sphere of our lives, and truly having an inclusive lens Until and unless that doesn't happen, whether it is women in industry or technology or education, and especially where there is an undergirding of social protection, women have to feel safe. Women here have been asking us a question on the chat box and the question and answer. Why is a woman bound to have a name of a husband or father with her in ID card? Can't she live with her own identity? And I think those are very valid and real questions to be asked today. We should not be afraid of asking questions which seem so logical and so sensible. It is with that intention that we had this dialogue today with these incredible women leaders of Pakistan across so many different areas of industry, education, protection, inclusion, technology, and investment and financing of gender equality. We hope that all of you who have joined us have taken some important takeaways, and we hope that from here we'll be able to start a couple of new innovations at least, which are inclusive, which bring more women in enterprise, which enable more women to finish 12 years of schooling. And as they're finishing their schooling, they're also being able to, or in being enabled to have more access to technology, more access to dignity and resilience. Because it's only when you have that, you have more confidence to be able to look for opportunities which will give you more protection, but also more opportunities for better financing on more equal terms. Yes, we mean that we want more equality, more equal women with better equity, which is irreversible in Pakistan. Thank you very much for joining us. Idara Talim Aghi is most grateful, and we hope that together, as full teams and alliances in Pakistan, we'll be able to do justice to this notion of gender equality, but not just the notion, but the practice and the principles of gender equality, and especially during COVID time as we enter the third COVID lockdown and God knows how many. So while the vaccines are coming and we are hopeful, we also know that our challenges are still complex. Let's work together. Let's work towards a more gender equal Pakistan, which much more entitlements that were given to women in the constitution, given to women in the international laws and the national laws and the conventions to which Pakistan is committed to, including SDGs 2030. Thank you very much for being with us. Assalamu alaikum. Pakistan, Zindabad.